Yeah, basically was this. We've been doing what's loosely described as preventive cardiology at Med Center for a long time. And the idea was that if a person has a cardiac problem, say a heart attack or bypass surgery, then the idea is to prevent them having a second episode. So the traditional programs are directed towards that kind of thing. And at the same time, in the last few years, there's been a little more interest in preventing that first event. Okay, so right now the emphasis is really preventive cardiology, preventing the first episode and subsequent episodes. To do anything like this in a hospital is really expensive, and it costs patients money in terms of co-pays and sometimes their own money, and it's very expensive. And the other point is that there are many state colleges up and down the state of California, plus junior colleges, where they have the expertise to deal with the problems that these patients have, like weight management, exercise, their diet, nurses, and psychologists, and variety of expertise like that. And you need a few doctors to come and help out. But generally speaking, the other kinds of expertise are readily available. And so what Dianne and I thought was going to be a nice thing to try this as a prototype, where if we can make it work here at Sac State, then there are 21 campuses up and down the state. They could do the same thing elsewhere too, just copy it and make it work. And the advantage also is this, that it will benefit patients who are likely to have problems, and it's way cheaper to prevent a problem than to treat one. That's the first thing. And secondly, it provides an opportunity for students to come here to do internships. Now, most of these people are like that. They come here and help out the program, deal with patients. They get experience that they wouldn't otherwise get. And so we felt it was kind of a win-win situation for everybody. The big thing, a lot of the time, for these kinds of problems, the way it presents itself is like this. You go along like nothing's wrong, and suddenly there's a catastrophe. It's not like you have aches and pains and things get worse and gradually things blow up. It's not like that. You just go about your business, and one fine day something bad happens. Now, in a situation like that, with that background, it's very hard to go back to a patient and say, you might be in danger of a problem when he feels fine or she feels fine. Secondly, there's a belief also that if they have been treated once with whatever that's done in hospital when you have a heart problem, they feel they're cured, right? And so it's back to business as usual, which is not the case. So that is the big problem, in that the caregivers, doctors, nurses, everybody involved here has to convey to the patients the idea that there's everything to gain by taking care of yourself. And so that is when you say we talk one-on-one with patients, we spend a lot of time talking because the more times you say it, eventually it helps to understand what the issues are. There's no magic formula to this, because a lot of the time you're asking people to do fairly mundane things, like take care of what you eat, take care of your weight, make sure you're active, and do some reasonable amount of exercise. Make sure if you're being treated for high blood pressure, make sure you take those pills as prescribed. So it's not a lot of major complicated issues, but what we want to do is to convince the patient that every little thing is important, and that's where much of the effort goes in. This is not really doctoring as such. Any one of these people here can make a significant contribution to what patients need, and that is the big thing. And so we try to work like a group, like a team, so that the final product is much more than the bits and pieces we do. It's great. This is an empty room, like a year back. Every single piece of equipment is a donation from a patient. And it's great. You can't ask for more than that. And all the people who work here are volunteers. This is a pilot program because we want to convince the people at Sac State that this is a viable proposition. And so that's the phase we are in. And at the same time, we are trying to secure some grants and things like that in order to make this happen and continue. But it's been a good experience from our point of view, because a lot of patients have stepped up and helped us all.
And you just got back from Sri Lanka. What did you do there?
I'm from Sri Lanka, so and they asked me to come this time with a group of people from here to run a few workshops along the same kinds of ideas, because there's a belief really that these kinds of diseases, what are called non-communicable diseases, are essentially a Western phenomenon, that it happens in the United States or Europe but not in Asia. But that's not true. It's exactly the same. The nuances are slightly different, but the phenomenon is still the same. People are overweight, people have high blood pressure, they're not exercising, doing all those kinds of things. And so the message is still the same. And unfortunately, the idea of doing something about it hasn't quite penetrated. They're just starting, and so we felt good about going. This is a book that a couple of my associates and I put together. It's based on recipes that patients have provided, which are loosely described as heart healthy. They're all vegetarian recipes, and for a long time we ran a program at the Med Center called the Heart Disease Reversal Program, and it was basically on the principles of Dr. Dean Ornish's program in Sausalito. And these recipes were essentially provided by patients, and so they used to bring their own modified recipes from their favorite dishes, and we collected them all and we now put together as a book.